what is the connection between getting a knee implant or hip implant and getting pneumonia? Well, you know, the knee implant or hip implant leads to being sedentary in bed, which leads to not being able to, you know, they probably have a little bit of decreased lung function. So they can't get the particulates up, so they settle down. And the immune system kicks in and tries to fight that infection. And it's the immune system that fills the lungs up with fluid, and the person gets pneumonia. Okay? So it's incredibly important. And when you're designing something for the lungs, you have to make sure that whatever you're designing, even if it's a bronchodilator for asthma, you have to make sure that it doesn't affect the immune components of the lungs. Because you can give that person pneumonia just from your inhaler. So ventilation and conduction. Conduction is very important, and depending how big and how dense the particulates are in a drug delivery device, it's going to determine how far down it goes in the lungs. There's a simple correlation there. There's more to it, but that's basically what you have. So, pharynx, trachea, you guys are all familiar with this, I'm sure. And then trachea bifurcates into left and right bronchus, and then the left and right bronchus bifurcate even more to the bronchioles, the smaller bronchioles, and then the terminal bronchioles, which are teeny, teeny, tiny, and then the alveolar sacs. Now, if you're designing a drug delivery system to treat a pathology of the lungs, and it's not pneumonia, but it's a pathology of the lungs, it could be even cystic fibrosis. All right, what about incorporating a gene in your drug delivery system and having a cystic fibrosis patient inhale that, and then the gene actually transforms the cells of the epithelium, and now you treated a cystic fibrosis patient? I mean, that's a possibility, right? But anything, when you're treating the pulmonary system, you typically treat the left and right bronchus and the bronchioles, right? That's really what you're looking for. You're not looking to deliver your drug or your particles any deeper than that. If you're thinking of using the lungs as a drug delivery system, you don't want your drug delivery system getting stuck here. You want to deliver it all the way down the alveoli. Okay? So you have to look at it from two different ways. And see these little bifurcations? At all these little bifurcations, you have clusters of macrophages. And they sit there. And they really screen what you take in. So you don't want to activate them. You're blowing particulates into the lungs, but you don't want to activate these clusters of macrophages. And in some autoimmune diseases, it's very interesting when you have this autoimmune systemic inflammatory response. One of the ways of diagnosing a systemic autoimmune disease is taking an x-ray of the lungs and seeing if those macrophages on those lymph nodes there are swollen, if you can see them. So they're very intricately involved in that immunology, keeping you from succumbing to any bacterial or viral infections or particulates. Again, another common example of these cells activating and almost really deleteriously for the patient is coal miners. You know, you hear black lung. People can also, I mean, there are interesting stories. My great-grandfather owned the first bakery in Rhode Island, right? He died of white lung disease. So he was inhaling flour. And he activated those macrophages, right? And he died of, same thing a coal miner would die of, but it was flour instead of coal dust. So it's odd. It's an odd thing. But you have to be very aware of that immune system. So if you are traveling down, say you're on the Magic School Bus. You guys remember that? You did see the Magic School Bus, right? Okay. And you're traveling down the trachea, and you're looking at the lining of the trachea, the bronchi, the bronchioles. It's all epithelium. Remember, anything covering or lining your body is epithelium. So if I turned you inside out, you would not be pretty, but you'd be made of the same material outside as this. Same thing as the lungs. So when you follow that down, though, you'll notice a difference in the structure of the epithelium. So when you look at the bronchi, start with the bronchi, the main bronchi, you have ciliated epithelium. So where it says human bronchi would be the lumen of the respiratory system. You have the ciliated epithelium, but you layers, okay? As you travel further and further down the tree to the bronchioles, and the terminal bronchioles and the alveoli, you end up with a one cell layer deep surface, okay? And one thing I just want to show you here is when you take a look at the terminal bronchioles, there's just one cell layer, okay? When you get down to the alveoli, they have, these cells are structured so they allow for diffusion, one cell layer, but they're not columnar, they're flat, and that allows for more surface area. So it totally makes sense, right? Depending on what you're designing for, you have to know your cell structure. And one important thing here, you see the goblet cells. The goblet cells are the immune cells, part of the immune cells of that, the respiratory tree. And this just shows you here a gland, the bronchioles. So mucus gland, you guys have mucus. What protects you in the respiratory tree? You have the ciliated epithelium, you have the mucus, okay? Mucus traps particles, the cilia moves those particles, and then you cough, and that allows for expulsion of the particles, okay? Cystic fibrosis patients, there's a problem with chloride ion channel. They don't make, the mucus isn't hydrated enough, so it's really, really, really thick, and it sticks there. So that cilia can't work. So everything, all the particles come in, and they just sit there. And so they are always battling bronchitis, pneumonia, things like that. The one thing that is important in this slide, some of the functions provides a low resistance pathway. What a great pathway to deliver a drug. You don't have to go through the skin, right? You don't have to go IV. You don't have to worry about bioavailability. If you give someone a drug orally, you lose about 50% of the liver. So you have to kind of figure out the dose. Here is low resistance, high surface area, doesn't go through the liver. Perfect. Okay? Sometimes you have to deal with the fact that your lungs are warm and moist. And so if you design a polymer to deliver all the way down there for drug delivery, hygroscopic polymer is going to swell because there's water in there. So that's just one of the details you're talking about. Okay, this is the blood around the alveoli. So basically each alveolar sac in the lungs at that gas exchange region is surrounded by capillary. Really, really efficient. It's like a 1-to-1 ratio. Okay. So up here is the pretty much the last slide as far as just discussing the physiology. But very important is the surface area, the fact that one cell layer thick, rapid gas exchange. Again though, you have to worry about these right here, these type 2 macrophages. If you design a drug delivery system that's going to hit these alveolar sacs, maybe the particulates are small and dense, and you have a compulsion canister, and so it's almost like a metered dose inhaler if anyone has those, and you deliver that polymer with drug all the way down to the alveoli, right? And you want the drug to diffuse across the space into the capillary. That's fantastic. But if that polymer and drug combination causes an immune response down there, you're going to activate these cells. And the last thing you want to give a patient is an immune response at that gas diffusion location, because you will kill them from pneumonia. Basically, you'll kill them from suffocation. So let's see. This is conduction pathway. We're going to get back to this after. This is incredibly important for designing drug delivery for the respiratory system. Certain particles stick to certain locations. Has anyone done the, was it Advair? Has anyone used Advair? And it has that metally sort of, has that metal taste to it. And you use it, and a lot of it sticks to the back of your throat, and it's awful. That's because even though it's a good product, the size of the particles determine where it's going to be distributed. And so you get a portion, maybe 20% of that Advair dose where it's supposed to be. The rest of it sticks in the back of your trachea and back to your nasopharynx. So the conduction pathway and the size of the particles and the density determine how successful you are at delivering drugs specifically to different regions of the lung. Once, and I'm going to stop with this and begin on Monday because I'll go through all the types of delivery systems on Monday. But once you have delivered, say you designed the perfect microparticle, okay, and it's encapsulating a steroid, and you're treating maybe bronchial inflammation from whatever, and you've delivered it to the bronchioles, so it's a fairly compact particle, fairly dense, delivering it right down to the bronchioles, lower down in that respiratory tree. Now, how does your drug get into the body or get into those cells? There are three basic ways. Okay? The drug can go slowly in between the epithelial cells and try to find their way that way. All right? So that's intracellular. Only drugs that are based on fat, on lipid, can go directly through the epithelium. That's the fastest way. And if you can get a fat-soluble drug, that's perfect. I mean, you're golden. And the last is very relevant for gene therapy. If you're using this sort of technology for gene therapy, is transcytosis. You deliver your drug or your gene to the surface of the epithelium, and then they engulf it and bring it in. So there's only three ways, once you get it there, to actually deliver it to a specific cellular target. So when you think of this, think of the big tree, and then think of where in that tree you want to treat, whether it's higher or lower. And then once you've located that spot, how's the drug going to get through? And then on Monday, I'm going to go through what types, and then what are the reactions to the biomaterials that are used for these sorts of products. So I don't know who wants a exam, who doesn't. What I'm going to do is I'm going to take it with me. Next week I'll have them up on the 4th floor in Biomed. But I'll put them over here if anyone wants to grab them.